The people that come to me looking for an oral appliance to treat their obstructive sleep apnea have usually had an experience with CPAP. And usually that experience has been dissatisfying. Some people find it really uncomfortable. And so there's a certain part of our population that tolerate an oral appliance far better than they do CPAP. And if you have CPAP and you don't tolerate it, that means you're not going to use it and it's not effective. So, if that's the case, then you really need to try a different option, which would be an oral appliance. And that oral appliance, most of the time, is very effective, as the CPAP would be, except that it's just more comfortable and you can slip it in your pocket instead of having an extra suitcase when you're traveling in the airplane. And so from a patient's perspective, typically an oral appliance is more comfortable and equally effective. Now, from a scientific perspective, we have such organizations as the American Academy of Sleep Medicine and the American Academy of Dental Sleep Medicine that have both looked at this question, is CPAP better or is an oral appliance better? And what it comes down to is that an oral appliance is equally effective in most cases for people who have mild and moderate sleep apnea. And it's accepted as a first-line therapy for those people. Additionally, though, one of my colleagues in San Antonio when we were doing research together, he was actually studying how effective is this for severe obstructive sleep apnea. And in that, I was treating some people with severe obstructive sleep apnea. And given the right parameters, it is equally effective as CPAP. But we do try and encourage people to find what works. Now, for someone who has really severe obstructive sleep apnea, we can take the two technologies and marry them. So you have an oral appliance that keeps the airway open during the night, and you have air that is pressurized to make sure that you're getting proper air delivery during the night. So for someone who's really severe, sometimes neither one is the answer, but the marriage of the two is that answer.